If you can't tell by the title of this video, obviously I have some very big news to tell you. About 2 weeks ago, I went for an interview at a pair of sister hospitals. One was for a med-surg unit and the other one was for the special care nursery. I am happy to say that about 2 hours after I left the interviews, I received a call informing me that I had a job offer from not just one, but both units, and I was so excited. They told me that I didn't really have to tell them right then if I wanted to accept the job opportunity, but I went ahead and told them that I want to work in the special care nursery. So a special care nursery is a level 2 neonatal center, whereas a NICU is a level 3. The level 2 takes babies that are, this particular one takes babies as young as 28 weeks, but most special care nurseries don't. They do take intubated babies and babies with chest tubes and other complications. However, if they get more severe, then they tend to go to the other hospital with the NICU. The other hospital with the NICU, I wouldn't mind working there. I like that unit. I've been there several times. But I kind of felt like I would be stuck in the NICU if I worked there. There's not a whole lot else that I could go and learn about. I basically would be floating between their special care nursery and their NICU. Whereas at the hospital that I've accepted a job at, they don't have very many babies on a regular basis at the special care nursery. So whenever there are not enough babies for all the nurses, I will be floating to peds and mother baby to help out in those departments, which is great for me because that means I get to learn about mother baby, I get to learn about peds, I get to learn about all these other things besides just NICU or special care nursery. So I'm very, very excited about it. I will be starting probably in February, but not 100% sure on the date yet. I have to schedule my NCLEX after I graduate, so I'm hoping to do it mid to late January. And that's my big news. I'm just so glad that it's over, that I have a job. I'm still going to be interviewing at the other hospital for the NICU and for another med-surg floor, just to see what they offer me and to see what their interview process is like compared to the first hospital. But I am pretty sure I'm going to be working at the hospital that I've accepted a job at, and I'm very excited to start. I don't think it's really hit me yet that it's really real. I still feel like I have something I need to be doing, and I still need to be scrambling and looking for a job, and it's great to know that that weight is lifted off my shoulders for this last semester of nursing school, because a lot of people are freaking out now because the hospitals actually have stopped accepting interviews for the children's hospitals because they've had so many applicants. So I applied about 2 days after the applications opened, and luckily I got calls from both hospitals saying that I had applied so early and that I was one of the first people that they had called. And when they hired me at the hospital that I accepted the job at, they told me that I was only the second person that they had hired so far. They said the first person already worked here, so she doesn't even really count. So I was the only person who had not previously worked at that hospital who got hired by them, which is great. So I encourage you, if you're like me and you procrastinate on some things, do not procrastinate on job applications. As soon as it comes out, just go ahead and do it. I stayed up one night, like until midnight, just filling out the applications for both hospitals. I did them both in one night. And you don't have to have registered for your NCLEX or have completed your background check or any of that stuff to apply to these hospitals. And you don't have to have a letter of recommendation to apply to the hospitals. You might want to bring one with you when you go for your interview, or like this other hospital is requiring that I bring 3. And the first hospital didn't even require one at all. So I'm going to interview at the other hospital and see how that goes. But for now, I have a job and I'm so excited to start. So that's my big news. And I'm so glad that I get to do what I wanted to do. I was debating between special care nursery and med-surg because med-surg gives you so many opportunities and you can pretty much go anywhere. If you do med-surg, then you could go to ER, you could go to OR, you could go to peri-op, you can go to chemo. I mean, there's so many opportunities. You could go up to ICU. Many opportunities with adults because there are more adults in the hospital. However, I have been working with adults for about 5 years and I don't want to get burnt out on it. And I weighed the pros and cons between med-surg and babies, and I realized that babies was a better fit for me. And I'm gonna be thinking that they're super cute like every day, so I'm just very excited. Anyway, I just wanted to make this quick video just to tell you my exciting news, and that's it for today.